Hi, welcome to another edition of Health with Patricia. With me, Patricia Roxanne Hammond. I'm here at Spine and Nerve Center at East Legon to speak to Dr. Craig. Today, we'll be talking about cervical spondylosis, and Doctor is going to give us all the education. Note that Spine and Nerve Center is a non-surgical facility, so if you're scared of going through a surgical procedure or maybe your doctor recommended surgery, please remember Spine and Nerve Center. There is no surgery, there is no medication. All you need is to come here, and whatever procedure they will take you through, I bet you will be fine and you'll be sorted. Dr. Craig, thank you so much for giving us another time.
Well, thanks again for having me, Patricia. I enjoyed the last one.
I'm grateful. So today we're going to talk about cervical spondylosis. But before then, I want you to tell us, what is cervical spondylosis?
So cervical spondylosis is degeneration of the cervical spine. So when we look at the model, your spine is made up of the cervical, the thoracic, and the lumbar area.
Okay.
So cervical spondylosis is indicating where we're having the spondylosis. We can easily have lumbar spondylosis, which is quite common, and then thoracic spondylosis. But cervical and lumbar are the most common areas that you're going to have the spondylosis. Spondylosis just means arthritis. It's a fancy way of saying arthritis of the spine. And arthritis of the spine is made up of different components. You're going to have, the bone is going to malform. Normally in a spine, your vertebra look like squares. But when you get spondylosis, the bone begins to break down and you get these bone spurs.
Okay.
Then also part of spondylosis is degeneration of the disc. So the disc is squeezing down, we're losing height in the disc, and that puts pressure on the nerve. So here's another example of spondylosis. This is indicating a disc lesion as part of spondylosis. This one right here is showing how the disc dehydrates, it breaks down, the bone spurs that we're getting, and again, all that causes irritation on the nerve. That's where the pain comes from.
Okay. So what are some of the symptoms that one will experience to know that they have cervical spondylosis?
Well, the most obvious one is pain in the neck.
Okay.
You know, you're older, you're having pain in the neck, you get pain, you know, after you're, sleeping, you get pain while you're on your phone looking down. And then, so that's the first stage, and then the next stage is that you start getting pain down the arms.
Okay.
Because that's clamping down on the hole where the nerve is coming out, and that nerve isn't functioning right, so you get the radicular symptoms. And then once you get pain, the next stage is you get weakness in the arms. The muscles begin to atrophy, the muscles are getting smaller, and when it gets to the severe stages, you'll be dropping things, you're going to lose the ability to write, those kind of things. So it's progressive.
So can I say that when I sleep and I get up and I realize I'm finding difficulty turning my neck, is that also a cause of...
I mean, that very well could be cervical spondylosis.
Okay, but that one heals on its own?
No, cervical spondylosis does not heal on its own. The spondylosis, again, spondylosis is just like arthritis, and arthritis doesn't get better on its own. In fact, it picks up speed. The more arthritis you have, the more you're going to get, because you're losing the mechanics in the spine. A lot of times, the spondylosis begins when you lose the curvature in your neck. You're supposed to have a normal, it's called a lordotic curve, and that curve acts like a shock absorber. Okay. So the spine, the curvature is absorbing the force, but then when you lose that, then you're pushing down and there's nothing to absorb the force, so the force goes into the disc. Okay. So the disc is absorbing more force than what it's designed to, and then that disc begins to dehydrate, it begins to break down, and the ligaments that are holding the spine together begin to calcify. Okay. So that's where you get the bone spurs from. And then the more spondylosis you have, you begin to lose your range of motion, so you're not going to be able to turn your neck, as far.
So how is this diagnosed? Is it just by noticing the symptoms, or there's a procedure?
Well, the easiest way is X-ray. You can easily diagnose spondylosis via X-ray. MRI is always better because more than likely in the later cases of spondylosis there is disc involvement, and you want to look and see how severe the disc lesion is.
Okay, so take me through the treatment of cervical spondylosis.
Well, the treatment, you know, in the earlier stages, if it's not that severe, you know, you can do it with stretches and active rehab. You know, everybody, again, like if you're at a desk a lot,
Okay.
you know, you need to be stretching your neck. Or I see this all the time now where people, on younger people, it's happening on younger and younger people because they're always on their phone. They're always looking down.
We're in that era.
Yeah.
Yeah.
So I mean, if the first stages of is, you know, stretching and, you know, beginning exercises where you're basically bringing your chest backwards and bringing your neck back. So that's where we would start. Now, once it starts becoming severe and it's affecting you, then you would come in and see us, and we would do, again, what's called non-surgical spinal decompression, where we're pulling the vertebra apart and helping the disc to retract. So again, looking at the model, this is showing spondylosis. You have a disc that's bulging out here. If we can pull the vertebra apart and try to retract that disc, that will take pressure off of the nerve.
Okay. So this treatment is like a long-term procedure?
You know, people that begin treatment with us, we always have imaging, either X-ray or MRI.
Okay.
And so that will give us an idea of the severity of the condition. It'll also tell us whether or not we can even help the person. And once we have that information, that determines how often they need to be coming in or how many times they need to be coming in. Typically, people come in 3 times a week. It's either for 1 month, 2 months, 3 months, or 4 months. Okay. Depending, again, like on how severe the condition is.
Okay. I want to find out, so anytime somebody has something like that without consulting a doctor and tries to massage, you know, in Africa we like to either tie our neck with a cloth or get an ointment to just rub the neck, hoping with a pain medication, hoping that the massage and taking the medication will help relieve it. Is it also like something that you recommend, maybe at the early stages?
So again, with medication, it doesn't correct the problem and will only make things worse in the long run. So when it hurts for you to do something, let's say look down at your phone and you're taking pain medication to block that pain fiber, and you continue to look down, you're going to just cause more damage to the spine. But things that you can do at home, you know, massage is not a bad thing, but massage, you know, it's helping to loosen up the muscles, but it's not correcting the spinal problem itself. So again, I don't have a problem with massage. Massage can be a great complementary procedure to what we're doing, but it's not always going to correct everything that we're working on. And as far as like heat or ice, I'm a big proponent of ice. Okay. Ice helps to decrease the inflammation. Inflammation is a byproduct of the degeneration that's there. When the joints aren't moving well, it causes inflammation, and the ice helps to disperse that. When we're talking about cervical spondylosis, I mean, if we can take an ice pack, a soft ice pack, and kind of roll it up and put a towel around it, and you lay on that for a little bit, that can help. But icing is very good long term. Okay. Everybody likes to use heat. Yes, it's a normal thing. And heat is not bad, but it has to be moist heat. If it's not moist heat, it will help to dehydrate the area, again causing you more problems in the long run. So we want to make sure we're using moist heat. And then the other thing is we want to end with the ice. Okay. So because the heat will help to relax the muscle, but it can cause more inflammation in the long run. So if we relax the muscle, but then we use ice, that's the best procedure. What's the long-term effect if we don't seek help? It will get worse. I describe spondylosis arthritis like a tower falling over. So at the tower, it goes slow at first, but then it picks up speed the farther along it gets. Same with arthritis. The more arthritis that you get, the more you're going to get, and the quicker it'll happen. So correcting the mechanics in the spine is really important, and correcting the the activities that you're doing to cause the spondylosis in the first place is important.
Will it cause paralysis? Is it possible?
It's possible. I mean, in the most severe cases, when you're putting pressure on the nerve, then the nerve stops to function.
Okay.
So if we're having pressure because the hole where the nerve is coming out or the disc is hitting the nerve, that's going to inhibit this. And once we're at the stage where it's radiating, that means it's severe. That means it's not something that you can put off any longer. So because that will get worse. It may temporarily get better, but it'll come back.
Okay. That's serious.
Yeah. So whenever a patient comes in to see me and they have radicular symptoms, pain down the arms or pain down the legs, it's pretty much automatic that they get an MRI and we look at how severe the disc is.
Okay. So I know with the cervical is something that has to do with the neck. You mentioned one that's in the middle, that's common.
Well, thoracic, you have the thoracic spine here and the lumbar spine.
Is it the same procedure?
It's the exact same thing. The lumbar one is the one that's common.
Okay.
You get cervical and lumbar spondylosis.
Okay. So in a case where you see that the spine is protruding, what's that one also called?
A disc herniation, disc lesion, disc bulge.
People are born with it, or it's
No. It's acquired. The disc lesion that you're getting is the disc bulging out.
Okay.
Yeah.
Wow.
But that's caused from like the faulty mechanics.
That's a serious condition.
Right. Yes.
Yeah. Because with the education I'm getting, it's something, if you don't seek early treatment, then that's it.
The earlier you seek treatment, the more effective the treatment's going to be, the longer it's going to last.
Okay. At Spine and Nerve Center, do you offer pain relievers?
No.
Like medications?
Again, pain medication just blocks the pain signal, and that pain is telling you not to do certain activities.
Okay.
So the best way to do it is to manage the pain by correcting the problem. Okay. When people come in that are in acute like low back or neck pain, we recommend a brace. That helps, and then again we recommend icing.